As a hair transplantation surgeon, I have patients who come in all the time wanting a new hairline or fuller, thicker hair. The most important thing to me is that they achieve a completely natural looking result. Hi, I'm Dr. Jason Champagne, aesthetic facial plastic and hair restoration surgeon practicing in Beverly Hills. So tell me a little bit about what brings you in today.
Well, my hair has been bothering me.
Okay.
I've been losing hair since a couple of years ago.
Okay.
And the reason that I came is because I would like to see if you could help me.
Okay. Have you tried to do anything for your hair loss? Take medications, any kind of topicals, anything like that?
I've been taking like vitamin E, and that's it.
Anything seem to be helping at all?
No.
Okay. Well, what I need to do is I need to take a little look at your hair here and kind of get an idea of what's going on, and then we'll kind of go over what your options are. Okay?
Sounds good.
All right. So let me just take a quick peek. Tilt your head down for me. Okay. Good. Turn this way. So for you, after looking at the back of your scalp and wanting to fill these areas in, I think the best method would be to borrow a strip of hair from the back and then use that under microscopes, divide them all up into individual follicles, and then one by one transplant those into your hair, your hairline here to give you a nice natural hairline. So what I do is I transition your hairline from individual single hairs into larger groupings of hairs so that it naturally transitions as a hairline for you, and it'll look completely natural. Nice little undulations. It'll look super natural for you, okay? So back here, the reason I'm recommending doing the strip is because it'll give you the most growth and density for your specific problem.
If you do that surgery, how long does it take to start growing?
Good question. So the day of surgery, I take the strip, I stitch the back up for you here, and then divide that hair. And once the hair is placed, it takes about 5 days for those grafts to be seated well enough to where they can't come out, right? So there's nothing that holds them in place for those first several days. And then a little scab will form around each graft, and that's going to help hold that graft in. And then the skin will seal around that. So once that takes place, that's about 5 days, then you can start to wash your hair better, run shampoo and conditioner through your hair, kind of rinse out, all of the ointment and things that we place in your hair. And then those scabs will fall after about 9 to 10 days, and you'll be left with just the short hairs. So the short hairs that are there typically fall out in the first 2 weeks. So you'll go back to looking similar to this after 2 weeks, and then 3 to 4 months later, it's a long way to get to your answer, but 3 to 4 months later is when you'll start seeing your results.
How long does the surgery takes?
The surgery itself, to fill this area, I'm estimating will probably take us somewhere in the range of about 4 to 5 hours. It's a very tedious and precise process, and I think it needs to be. And I take a lot of care to make sure that it looks very natural. So to do that process and make it, the sites close enough together and a natural transition, about 4 to 5 hours. Also, during the surgery, I do it in the office under local anesthesia, which means that I inject numbing medication into your scalp. After you're numb, then I will harvest the hair from the back and stitch that up, and then I start making the sites in the front. You don't feel any of that process. Also, to keep you relaxed, I give you medications, a little cocktail of medications with a pain medication, an anti-anxiety medication that helps relax you, and an antibiotic. And so that will get you through the procedure. So you're nice and comfortable, more just relaxed while the procedure is going on. And actually, a lot of my patients end up falling asleep during the surgery. Okay? And remind me, you wanted to have a little more of your peak like you used to, right?
Yes, I would like to have this little point.
Okay. So like I said before when we first met, I want to keep your hairline about right here. I don't want to come any further down than that, okay? So I recommend, we stay right around here, and then midline. Okay, look down for me more. So Jorge, the first thing I'm going to do is I'm going to put your hair up back here. Okay, we've got a nice spot for the donor site. He wants to fill, his goal is to fill or create a completely new hairline and fill these areas right up front here. And with the strip method, in my experience, the growth rate is significantly greater than with the other method called the FUE or the punch method. The grafts do form little scabs wherever we place the grafts, so he'll have scabs throughout this area. Those will fall within about 10 days after surgery. And then from there, all of the hairs that we transplant, many times, within about 80 to 85% will fall out. And then the hair will grow in within about 3 to 4 months after surgery. So the only area, and I do have to shave part of the skin back, the hair back here. The only area that I shave is within the borders of what I'm removing. So you don't have to shave your head for this procedure, only the part that I'm removing, but when it's stitched together, the hair above and below will actually meet. And when he leaves today from surgery, he'll look like he did when he walked in the back here. You won't be able to see any evidence that surgery was performed in the back. It'll be hidden up underneath his hair. Okay, good. Using microscopes, we divide your hair into individual follicles that we then place one by one into sites that I've created. It's very trauma-free, and they're very delicately placed so that you get optimal growth. So we're all done. Why don't you go ahead and have a look? So if you look there, you can see that I did a nice natural transition of your hairline right there, a nice little undulating pattern. So it's going to grow in really well. Wow, it's going to fill in.
I cannot wait to see my hair grow.
Yeah. So give it about 3 to 4 months and you'll start seeing growth, okay?
Oh, thank you.
All right. You're so welcome.
Thank you very much.
You're welcome. If you'd like to see more, go to my YouTube channel at Jason Champagne MD or follow me on Facebook or Instagram at Dr. Jason Champagne.